Hello and good afternoon, Dr. Serrano Pons. My name is Rahul. I'm the head writer for 72 Dragons. And we also have Dr. Pietro. He's the Chief Operating Officer of 72 Dragons.
So welcome, Dr. Jordi Serrano Pons. Jordi is a leader in the global arena of health and the digital world. Thank you for sharing your knowledge and expertise with our audience today. And also Jordi is a good friend. You are a medical doctor and also the founder of Universal Doctor and UHDA Health, which stands for Universal Health Digital Access. What made you feel so connected with technology and medicine at the same time?
Thank you, Pedro. Well, the good thing is that at the beginning, and we are talking about 2007, 15 years ago already, when Universal Doctor was born, it originally was born because of a necessity, and this is very good. Precisely, we had problems to interview many foreigners and migrants in the clinics in Barcelona. We had a lot of tourists, also migrants, but we couldn't handle so many different languages. So that was a necessity, and that's why we came with that idea to build a software called Universal Doctor Speaker, which helped us to solve this communication problem. Basically, we could launch at that time audios in Urdu, Mandarin, English, French, so on. So you had the sentence in your own language, and when you click, you could launch the audio. Do you have a pain? In Arabic, Urdu, whatever. That was very helpful, and that's how the history started of Universal Doctor.
Oh, that's really interesting. Talking about Universal Doctor, can you talk a little bit about how Universal Doctor evolved from a single product of translation to a global company working for the digital global health good?
Yeah, absolutely. As I explained before, we started with this single product, which is a translation tool at the time. But obviously, we were a group of doctors, engineers, very involved in health, And obviously, there were some years that initially we had only this product, but then after the crisis, or because of the crisis always bring good things. We decided to move some of us to Geneva, because we used to love global health in general, and in Geneva there is the headquarters of WHO and other international organizations related with health. And basically, slowly we saw ourselves, we found ourselves starting to collaborate with other projects that had to do with digital and global health. And then it came the Ebola crisis, the Zika crisis, or different global health crises. And we participated with some of these international organizations to develop some of these digital health tools. And slowly we found ourselves from a company of a single product to a company where we had Universal Doctor, the digital global health company. We have developed more than 25 projects with international organizations like WHO, with research institutes like London School of Tropical Medicine, government, Spanish government, Belgian government, and in general institutions of global health.
Great. That sounds like you started from very little, and now it's grown into this big organization. And you mentioned WHO, the World Health Organization, and other international organizations. So I would think it might be a bit challenging, but how easy is to work with governments and the international organizations in the implementation of digital global health projects?
Well, year after year, it's becoming easier. 10 years ago, obviously the knowledge of what digital means, and remember that some years ago, still we were calling it e-health or mobile health, e-health, and slowly it has moved into more a global concept of digital health. But it was not always easy to work at the beginning with institutions that sometimes still were with the debate of how to call things or how to make evidence of these tools. And during many years, there was a gap between what it looked like was needed and the evidence to ratify that needed had evidence-based pilots, etc. Then it came the time where many pilots were implemented and developed at the same time, and you found yourself doing many projects, many pilots, but very few of them scale up.
You were talking about like how easy it has become to coordinate with the governments and international organizations. But as per your opinion, how digital health projects are helping to reach the SDGs, which are Sustainable Development Goals?
No, indeed, this is the most fundamental question, I believe. No, we have a clear SDG mandate. The good thing is that now the SDGs are better well known than the Millennium Goals were. You remember 2015, no? So at least we have advanced in that. A lot of institutions, companies know about the SDGs. That's the first step. Second step, in the case of health, SDG number 3, no? How can digital health help health, no? In that sense, obviously, in places where the system was not fit enough or well structured, the possibilities given by digital health, like also in places where you don't have any fixed line, people start to use mobile phones directly, no? Without passing through the fixed line. So it has happened a little bit the same in some aspects of digital health. But as always, if you have few doctors, few nurses, you cannot really bypass that implementing digital health. It can help you at some point.
Great. Thank you for sharing that. So yeah, the Sustainable Development Goals have this really big vision for change, and it's not always easy to get there, and it could be a bit challenging. But it sounds like the World Health Organization and other organizations are seeing the benefits of the digital world and how that can impact health in at an individual level and also the community level. Now, you've been working with Universal Doctor and now the newly launched UHDA, Universal Health Digital Access. Can you explain to us a little bit more about your new spin-off of these two organizations?
Absolutely. No, thank you, Pietro. Universal Doctor has become kind of a nice consultancy company for digital global health. So we are working right now, for example, in Universal Doctor, in a tool for diagnosing or making more available the knowledge to diagnose a skin neglected disease with artificial intelligence. But we're doing that in Universal Doctor, but also at the same time, we're also working with other governments, for example, with the small government of Andorra, small country between Spain and France. We have developed during the pandemic the personal health record of the citizen. So we have this variety of projects which enriches our knowledge a lot, and it makes us stronger by experience. But of course, this is a variety of global health projects, Universal Doctor. So we decided to continue with that because it gives us a lot of experience, and we like to work in different fields. But at the same time, focusing now in a spin-off called UHDA Health, Universal Health Digital Access, to really deliver two things. Very simple. Capacity of producing studies, simple and complicated studies, clinical studies, behavioral studies, by people who usually don't do this type of studies.
Yes, and talking about Universal Doctor and the newly launched UHDA Health, we do now see that there is more digital accessibility. So with the help of technology and digital tools available at our disposal, what do you think will be the future of medicine around the world?
Well, thank you it should be soon where we don't talk more about digital health. Health should be by definition digital, or partially at least, no? I mean, all the components, because obviously now with also climate change, and we'll talk later a little bit, maybe I would like to add something about this planetary health concept, no, if possible. But if we can avoid a visit, no, just to collect a prescription or just to collect just an outcome, blood results, if we can do that through a telemedicine, no?
Great. I mean, that's really helpful and insightful to see the importance of digital health. So connected to that, Jordi, as we mentioned before, you studied medicine, have a master's degree in health and environment, and a postgraduate degree in international studies from the University of Barcelona. You also mentioned planetary health. I understand you have a meeting 2 months ago. What advice do you give to new and aspiring doctor in the context of these planet challenges?
Absolutely. No, young doctors will face themselves with a ongoing crisis, no, to be as diplomatic as possible. I mean, there are already migrations, no, provoked by climate change crisis. No? People moving already because the heat do not permit the crops, no, to be produced. Inundation, floods, the sea level will rise, and of course, not to talk about all these heat waves that each summer are increasing, which produce a lot of fatalities, and the economy and the world moment where we find ourselves. I mean, these are difficulties, but the most important one is the number of aging population encounter themselves in this crisis, planet crisis. No, so this combination, it's a massive challenge.
Great, yeah. A planetary crisis requires dramatic changes. So thank you for sending this message to the new generations of doctors.
Yes, certainly. I agree with Dr. Pietro. With new generation of doctors, there are new challenges, and we do require new solution to solve these problems. Well, I think this brings us to the end of the interview session. First of all, thank you, and it was amazing having you here, and it has been a great pleasure talking to you.
Thank you to you, 72 Dragons, because you are doing a great job displaying all these different realities around the planet. So thank you very much.
Thank you.
Thank you.